So in regards to total hip replacement, will a patient do more damage to their hip if they hold off on doing it? The answer is technically yes, but more technically no. What we know is that yes, you just walking on your hip is causing damage. Is that damage going to turn into a harder job for the surgeon or a harder recovery for you? And almost always the answer is no to that. Yes, your hip can catastrophically fail for some reason or another, and that would make the job harder or the recovery harder. But by and large, the longer you wait, the surgery is not technically harder. We do see, though, that there's some considerations you must have. And what we know is that if you decondition yourself, or if you get to your joint is so tight that we can't move your hip around, in the knee, it's the range of motion of the knee, that we can't give you all of that back if you wait too long. In the hip, just overall stiffness is a bigger concern. And so we see patients who may become so stiff that it can be a little bit harder to do the surgery. That takes a really long time. And while that can be the case, it's the rare part. I think the bigger considerations you should consider are that the less you do because this hip hurts, you get deconditioned. And if you find yourself not doing as much and your heart becomes less healthy or your lungs become less healthy, and we call this the cardiopulmonary status. If you can't walk a city block, if you can't go up some stairs, then you've made it harder for you to recover. And that's where we try to get those patients into prehabilitation to get them stronger for the surgery. But overall, it's not really that you're damaging the joint more, making our job harder or your life harder. It's that you're creating an ecosystem that's not as healthy and supportive of the surgery, and we may have to get you back on track before surgery.